Well, 2022 was the most normal year for a while, but that doesn't mean it was non-eventful. Between the Inflation Reduction Act, Supreme Court Dobbs decision, big health tech acquisitions, and the continuing public health emergency and midterm elections, there was plenty to talk about. What will 2023 bring? Nobody really knows, do they? But we have some exciting predictions to share anyway. Welcome to CareTalk, America's home for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health. David, you basically disqualified ourselves to actually make predictions. Since we don't know what's going to happen, I think we do. I think we've got some pretty good ideas about what's going to happen next year. And you shouldn't self-disqualify yourself. I predict that you will continue to be a skeptic. I'm hoping for the opposite, but I doubt it.
Oh, John, I thought you were going to give me a little pep talk there for a minute. But, let's look ahead. I agree we have some things to say. But let's look back, too. One of the things I like at this time of year, John, is I get these things from my apps that tell me what happened over the year, like Spotify Wrapped and Strava Year in Sport. At CareTalk, we can do that, too. We rose to become a top 5 healthcare show, and you took a big new job. John, we had 1.6 million streams in 2021 so far. That's
wow.
up 25%. And 165,000 total hours streamed. That's up almost 50% since last year, John. And that's all by doing 2 fewer episodes, 56 instead of 58. What do you think of that?
I think maybe people are willing to listen more if we talk less. But David, I think there's a lot to be proud of. I was in Chicago last week, and a pharmacist, one of our leaders, regional leaders of the Walgreens team, was saying how much he enjoyed the back and forth and the topical nature of our healthcare questions. So I do think we're making a dent, and I look forward to another fun year with you next year. But let's do look back, because I do think that let's build on what we've done and talk about not just the public health emergency and COVID, but what's next. I mean, I think my prediction, it remains my prediction, David, that virtual care, that all this talk about technology and medicine will revert to medicine, and that virtual care will be care itself. And we'll talk more about the impact of what doctors and all other clinicians are doing. And it's going to be omni-channel, whether it's text or video or voice. And it's just going to be integrated into healthcare. And we're going to stop taking the innovations of the 20th century as new or novel and start thinking and more thoughtfully measuring how we get better outcomes for lower costs. I mean, are you still a skeptic about technology, David?
John, I agree with your prediction about, virtual care becoming care over time. I think in the meantime, there's a few things to prove. One is, meaning I don't think it's all going to happen in 2023. I think there's some things that need to be proved first, John. One is whether virtual primary care is really realistic, virtual first, or are we really just mostly dealing with urgent care? And then when you deal with specialties, is this going to be something that you can really do with virtual care? Or is it really just going to be sort of a secondary channel for established patients? Those are things that I think we have to consider.
Picky. I don't hear a significant disagreement there. Virtual care will be care, and we're going to stop treating it as novel. David, what is your next prediction? What is prediction number 2 for the CareTalk team? So
prediction number 2, John, should get under your skin a little bit, which I think healthcare staffing shortages will come to an end. Everywhere we hear today about big shortages, doctors, nurses, parking attendants. But I think what's going to happen, John, is people are going to say they need to work, and employers are going to find creative solutions to improve the situation as it relates to nurses. If there's a bit of recession, a lot of nurses are second incomes within families, and they may come back into the workforce, and there's going to be a plethora of nurses, and the job shortages are going to end in 2023.
Well, I'm impressed with the fact that you're expanding your vocabulary to words like plethora, but plethora is not what we are going to be faced with. Nearly a third of all doctors and a third of all nurses and 20% of all doctors are feeling really burnt out. The demands are going up. Children's hospitals are overwhelmed. It's hard to get nurses to come to the home, not because they don't want to, but because there aren't enough nurses. Our immigration policy is still screwed up. There's tens of thousands of clinicians around the world who would love to work here, but our immigration system doesn't move fast enough to accommodate that. There's 10,000 people turning Medicare eligible every day. David, you're just plain wrong. Those shortages will continue. I'm hoping that all these technology things that we were talking about will extend and ease the burden. But we're going to be facing, I think, the healthcare staffing burden for the next few years.
All right. Well, John, since you dismissed my number 2, I want to take number 3 as well. Here's another one you're going to disagree with, though. So I think that in 2023, Medicare Advantage will lose its luster. You know, people have been real big on Medicare Advantage. It's going to be probably half or more of all the Medicare eligible folks are going to be in Medicare Advantage. But it's starting to take some lumps. You know, it's being called managed care. It's being pointed out you can't choose your own doctor. People are saying, well, you know, those that are marketing it, not necessarily the plans themselves, but brokers and others are misleading the public into thinking this is a government program and using the Medicare logo and so on. I think Medicare Advantage, John, I don't know that its days are numbered, but I think it's going to at least lose its luster. And that's not as big of a word as plethora, but it's also like, it's pretty impressive.
I think that I'm stuttering here because I hesitate to give you credit on this one, but I think you deserve it. I think that
bring it on, John.
The brand positives of Medicare Advantage are based a lot on the genuine fondness and support that people have for traditional Medicare. But don't mistake the fact that Medicare Advantage for those members in those plans, coordinated care with a doctor that they know and trust and a system that actually pays attention to them, is not just succeeding because of the brand stuff. And I think there's a legitimate argument that there needs to be a distinction between managed care and traditional Medicare so that Medicare eligibles understand the difference. That's a legitimate gripe and criticism. But managed care works. I mean, and increasingly the benefits and the costs for the individual Medicare beneficiary are actually better under Medicare Advantage than under traditional Medicare. You know, over the last 10 years, all of those copays and deductibles in traditional Medicare continue to go up, and the cost of Medicare continues to go up. So I don't think I think it may have a regulatory comeuppance, but luster it will not lose.
Well, John, since you were nice to me, I'm going to give you a little support for your argument, okay, which is to say, okay, Medicare Advantage may have its challenges, may have some things that people don't always love about it. However, we are not going to solve our cost and quality problems with traditional Medicare. And if it's not Medicare Advantage, you tell me what it's going to be. All right. So I'm giving you a little support there, John. That's your early Christmas gift.
So, David, we've got to talk a little bit about value-based care. What do you predict about value-based care? You know, that's care on a budget. It's all of this episodes of care. It's where people get paid more on a per life or per engaged member or per procedure, like a knee procedure, than actually paid, you know, for every transaction and test and meeting and visit they do.
So, John, my prediction there is that value-based care is going to continue to make incremental advances. Now, it does tie into the Medicare Advantage.
I mean, that's the best you can do. You're a closet incrementalist. Is that what you're telling me?
So I'm going to say, John, I'm going to have to take your gift back, by the way. But with Medicare Advantage, I think a lot of the value-based care is actually occurring there. What I like, and the reason I say progress, don't focus on the incremental. I said progress. So there's more provider groups that are setting up to take shared risk. So, you know, you can't just take a regular physician that's getting fee for service and all of a sudden they can take risk. They can't really do it. They have to have the support to have it. And then you've got companies that are out there like Clarify, which will be speaking with the CEO, Jean Drun, in the new year, Credo, that we both advise, that are enabling this with data and analytics that say, now we have this framework, this idea of value-based care. Now we can put it we can make it reality. So I expect to see that incremental. And John, maybe for 2024, we'll be saying it's going to take over and be everything. But yeah, progress, incremental.
Oh, that's not really much of a prediction. I mean, I think you can do better than that. I think value-based care is going to make big gains because we have to move to a budget. I mean, obviously, Walgreens has invested in VillageMD, which is an important and a leading value-based care, primary care group, but you're going to see more of that. There's plenty of other competitors in the market like Agilon and Privia that are really interesting. I think it's making bigger progress than those of you who have your heads firmly planted in the past will be aware of. David, what about home-based care? I mean, obviously, I'm biased there. I think that's the future. What's going to happen with home-based care in 2023?
John, so I think that's be our prediction number 5, and I'm wary of making any incremental predictions. So I'm going to say home health care will become super important in 2023. I think what we're going to find is that people now have gotten used to being at home during the public health emergency. Hopefully that will end. They'll have the ability to go out, but they'll say, you know what? It makes sense to be here. This is where it makes sense. It also makes sense for people to be observed in their home environments. It's going to be more cost effective and better quality. I also see that there are companies that are now taking this home first approach and saying, let's re-examine our assumptions about what can be done in the home and not. One company I saw mentioned is a fertility company.
Don't do it.
Now, John, I know I'll say that there's the male side of it, okay, which you don't need to come into the hospital in order to produce a specimen. But also even on the ultrasound side,
I thought the whole point of this prediction thing was so you could talk about home sperm sampling.
Fine. So those of us who are of childbearing age, you could check, you can do the home sperm sampling. But also, John, believe it or not, the more interesting part is that ultrasound, and typically actually transvaginal ultrasound, is used, not on men, okay, but on women.
You're getting confused here. First of all, you are of child rearing age, not childbearing. I think you get off of this. Like, we agree on this one. You use this just to bring up the home sperm sampling.
No,
let's be honest.
Home ultrasound, John. Just think about it. It's you're just focused too much on the midsection of our predictions.
What you need to think about, David, is the convergence, which is the underlying point you're making, of technology, which about monitoring and the miniaturization of tools, and meeting the consumers where they are, which is at the home where they want to get care, where the vast majority of patients want to heal and age. So, David, you've been a bit of a critic, but also a partner to private equity and venture capital. What's going to happen to them in this hotter regulatory environment?
Well, John, I know you're a little squeamish talking about basic sexual functions, but when it comes to private equity,
it's just too much of a focus for viewers.
Private equity owns a lot of the economy, and they've been kind of in the background. And now, since healthcare is 20% of the economy or so, there's a lot of private equity involvement there. And one of the strategies that private equity uses is try to make companies more profitable. And, often that involves increasing prices or having more consolidation. And there's going to be more scrutiny in the same way there is of Medicare Advantage, whether that's good or bad systemically for healthcare. It's good for the limited partners of the private equity firm. It may be good for the companies, but now there's going to be more scrutiny. And I think that the PE firms better be ready for that scrutiny that they're going to get.
Yeah, I think that prediction is legit, but I want to add a piece to it that all I think what people need to be thoughtful about is there are in the same way that there are good companies that are good fiduciaries and good caretakers of the sacred trust of actually working in healthcare, and there are bad companies. There are good PE firms and bad PE firms, and there are good investments and bad investments. And I really hope that the fact that the investment structure is different shouldn't be used to do a kind of the kind of tribal takedown that you sometimes try on this podcast. The reality is there's a lot of good that all of this capital going into healthcare has created. It's created some of the most innovative care companies in America. I mean, HCA is a super successful, super high service organization. And I think so is the Cleveland Clinic. And they exist in a for-profit and a not-for-profit world, but they both excel at what they do. And so I think in the same way that there are good and bad public companies, I'm sure there are good and bad private companies. And I think everyone in healthcare should be ready for more oversight. There's certainly one of the things we learned in the pandemic is when there's no oversight, people make bad decisions. And you saw it with nursing homes in New York. You saw it in the ways that the hospital supply chains were managed. And I think that oversight, while uncomfortable for leaders in business, is really kind of necessary. And that is one of the lessons from 22 that needs to be carried into 23. And I think it'll be true of different forms of finance. So, David, what do you think about artificial intelligence? I mean, it's certainly something you've relied on personally for many years.
You got to have something, it's not coming out of the natural side of things. I think it's actually, John, I'm going to say here, I'm going to go negative at the,
a first.
Okay. So I think it's going to sputter for now. But eventually it's going to prevail, but not in 2023. So you have some things that are very good. Like there's tools that can use artificial intelligence to diagnose based on somebody's voice, or the cough, what problem they have. I would love that right now, John, but I don't really want the diagnosis. I'd love the cure before we get to the final predictions here. But it's helpful, I think, also for, tough diagnoses. You hear things like this diagnostic odyssey, somebody with a rare condition. They may go from doctor to doctor over many years before they get the diagnosis. With proper AI tools, a number of factors could be put together and actually pick that out on the spot. That's where you're going to see some of the promise. One of the reasons I say it's going to sputter, John, is that we see in artificial intelligence, unfortunately, it relies on existing human regular intelligence data sets. Those have a lot of biases, and you can risk actually encoding the biases into a permanent artificial brain. Could be a biased brain.
You should put your own biased brain aside for the moment while you
try
to make a prediction with a foot in two canoes. One saying AI is going to sputter, the other that is AI is intelligent. Make up your mind. I mean, I think what's going to happen in 23 is more and more machine learning and intelligence will be embedded into care. And like technology in general, and my comment about virtual care, AI is going to matter, and you're not going to know it, because you're talking about, encoding human bias. We've already got human bias. You see it in the lack of recognition around how much racism is involved in care, how people of color reliably get less care, not because of the intention of the doctors, but a lot of encoded biases in the system, which already exist. I think the intelligence and machine learning are going to be more and more relevant. And I think that's going to be a lift for healthcare in 2023.
John, all I can say is the foot in two canoes does not sound positive for male fertility.
So, David, I've got a point of view here as the president of Walgreens Health, but what do you think about retail healthcare? A little bit like value-based care. It's been promised for for like almost 2 generations now of healthcare leaders. What's going to happen with the convergence of healthcare and retail?
John, I was just quoted in the Boston Globe in a lead story about how hospitals are struggling, and I think it needs to be looked at in the overall environment. Hospitals have really been crushed by the public health emergency. You see nursing homes are really struggling, and retailers have actually stepped up despite some challenges of their own. And you'll see that, the pharmacy is becoming, we talked about the home being the center of the care, which I agree with, but pharmacies are a place that people, really rely on, and pharmacists they're able to see. And so I think that you're going to see more growth there. It's going to be bumpy, but you're going to see more retail oriented approaches, including, urgent care, primary care, the physician, the pharmacist potentially expanding their scope of service. I see more happening, John, because of what the retailers are doing themselves, including your company, but also some of the struggles in the rest of the healthcare delivery system.
Yeah, I think it's a really good point, David. I mean, obviously, I'm betting my career right now on the fact that Walgreens, CVS, Walmart, and others Best Buy, will all take different paths to help extend and connect the healthcare system to our most vulnerable. One of the things the retail sector has is trust, traffic, convenience, and clinicians. And I think all of that adds to the healthcare service stack, if you will. And by connecting everything, or connecting more of the system through technology, the emergence, which we're not going to talk about because we both agree on it, the standardization of data and data transfer is going to allow us to sort of seamlessly, perhaps with some artificial intelligence, connect more of those patients to more of those care access point at a time when care access still is important. Retail is going to be even more relevant in 23 than ever. And I think that what's going to be interesting is each of the retailers, each of these large scale innovative retail companies is going to take some common and some not so common paths to drive that.
So, John, I think you need one thing I'm going to predict is that you're going to come up with a little catchier way of saying that in 2023. So I heard I think you need the 4 T's. I heard trust, traffic, and then you said convenience and something else. What was the other one?
Connection.
So
you don't have to be illiterate.
Trust.
Stop.
Yeah, I like alliteration, John, as much as I like assonance. But I say trust, trust, traffic, therapist, or that's not good because that's a T, but it's the wrong sound. We'll have to work on that one. All right, John, I'm gonna make prediction number 9, okay, for 2023, the last one. I think it's going to be a relatively mellow political year for healthcare. It's going to be a pragmatic year. There's not going to be a lot of stuff at the federal level, and there's going to be state level initiatives. That's going to be the laboratory of innovation. The states, they're going to work nicely together, and it's going to be mellow politically.
Oh, you finally come up with optimism. First of all, that is only prediction number 10, David. But let's be honest. We will not escape the divisiveness and division of this country. But hopefully, leaders in the public sector can quietly work with leaders in healthcare to keep the politics of healthcare mellow. But I fear that at the whether it's about gender identity or vaccine, I mean, you got DeSantis already pre-disqualifying himself from a presidential race by suggesting that all the vaccine information was wrong, reversing a position where he actually wanted everybody vaccinated. No, I think the politics of healthcare are going to stay hot. I just hope that they stay irrelevant as well.
Well, John,
David, with that, David, I mean, come on. I thought you'd come up with something maybe we could agree with, but no, we will continue arguing well into 23.
Well, John, I think unlike the person you just mentioned, we're going to stay hot and relevant in 2023. That's it for yet another episode of CareTalk. And in fact, that's it for yet another year of CareTalk. John, it has been great Care Talking with you this year. We got to do a little bit in person. We had some great guests. We had some great topics. You still are very reliable in calling me an idiot. And so I always appreciate that, something to look forward to. Well, I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the president of Walgreens Health. David, I also always learn something from you. So thanks for another great year of Care Talk. And if you liked what you heard and you didn't, please subscribe on your favorite service. Thanks for listening.